The previous video was where there was carcinoid syndrome and Hartnup disease. Here we focus on OCD depression. What I told you is, in the synaptic junction, serotonin should come and bind to the receptors present on the postsynaptic area. For example, normally 10 serotonin molecules can come and sit here. When the work is done, 8 to 9 serotonin molecules can be taken back up. Again, more serotonin can come back into the topic. Now, there are people who generally have less serotonin here. Instead of 10, they will be having only 5 serotonin molecules coming out. Out of 5, if all the 5 go back by reuptake, there is no serotonin. That is why the patient has a disease called as OCD or depression. I'm not saying there is zero serotonin. I just gave you an example that serotonin concentration is lesser. So how do we deal with this? Here, in case of carcinoid syndrome, serotonin was in excess, which caused the clinical features. Here, the serotonin is lesser than normal. That is why we have the disease called as OCD and depression, because they are lesser than normal in the synaptic junction. So serotonin is acting as a neurotransmitter. There is a deficiency of the neurotransmitter called as serotonin in the neuronal cells. So what do? The drugs SSRIs, selective serotonin reuptake inhibitors, are blocking the reuptake. If this reuptake is blocked, then they will sit more on the receptor. When they are sitting more on the receptor, their effect is for prolonged time. You are not capable of offering serotonin from outside, but you are capable of blocking the reuptake of serotonin, which is already present inside. So the content of serotonin in the junction is increasing, because of which you can treat these two diseases. Cut.